Good morning, Peter Goertz. I'm a psychiatrist. Does self-help help? I'm talking about positive thinking, affirmations, visualization, yoga, tai chi, meditation, diet, exercise, sleep hygiene. In my opinion, they all can help. However, we want to be careful regarding whom we're interacting with. For example, which patients we're interacting with. We do not want to have an attitude that basically tells a patient, get over it, do it yourself, you don't need help, pull yourself up by your bootstraps. That can come across as arrogant, condescending, prejudicial. If we're interacting with someone who's psychologically overwhelmed, especially. So we would probably not do that if someone were lying on the ground bleeding from a gunshot wound. We would not say, oh, just get up, pull yourself up by your bootstraps. So we want to be fair and courteous. And in the same vein, we don't want to, if someone's psychologically overwhelmed, we don't want to transmit that we think taking psychotropic medication is a sign of weakness. That's the same type of thing. We would probably not do that if someone were sick with serious pneumonia and taking antibiotics. We would not say, oh, you're just weak, you don't need antibiotics. In psychiatry, we're dealing with people who are often, at least, severely troubled, hearing voices, delusional, suicidal, physically aggressive, out of balance mentally due to alcohol and or drugs. And from what I've seen over the years, these people can really be helped by stabilization with medication, for example, before possibly then being ready for self-help and open to self-help. Another aspect in psychiatry is often we deal with people, interact with people who are homeless, poor, have inadequate food, unhealthy food, are socially isolated. And if someone has no food and no place to stay, is that the right time to recommend a self-help class? Probably not. We want to meet the patient where they are, get a sense of, and we can directly ask them, what kind of help would you like? What do you feel would help you most? In New York, there used to be a program where staff approached patients on the street, homeless patients or homeless people, and offered them housing right off the bat. That seemed wonderful to me, and it seemed to work out quite well because the homeless people often did have mental illness, but they were relatively easily approachable often if someone offered them housing. And then by connecting with the staff of that program, then some of them became willing to take some psychiatric medication, and some remained reasonably stable even without psychiatric medication. Just with housing alone, and probably they gave them assistance also with food. And I would see some of those patients at times during the hospitalization, but that team that worked with them for the housing was very helpful, and their relationship with the patient was good. Thank you.